So I'd like to tell you about two medications that are particularly helpful with orthostatic intolerance. These two medicines essentially accomplish the same thing, that is to bring blood volume in centrally so that it's very close to the heart, so that when the heart opens up, it will receive more blood, and in doing so, when it contracts, it will have more stroke volume and more cardiac delivery to the brain. Okay, so these two medicines work very, very differently to accomplish this same task. One is called Midodrine, and the other one's called Fludrocortisone, and they both have their pluses and minuses. So let me tell you about Midodrine first. Midodrine is a medicine that is short-acting. It works for about 4 hours duration, so you have to take it multiple times through the day. And what it does is it basically clamps down small blood vessels in your skin and in your muscle and in non-essential organs. And in doing so, it drives blood centrally so that it fills that central tank, ready for the heart to open up and receive that blood. Now, when you take Midodrine, because it drives blood away from your skin, it tends to make you feel cold. And so it will give you goosebumps, and it will give you tingling scalp. And so I want you to think of that as your Midodrine working, because it's driving blood away from the skin, making you feel that way. So don't think of it as an adverse effect, but rather the Midodrine's working. And in doing so, you know you're going to feel less fatigue, more ability to be in an upright position, and without being dizzy, and you may even think more clearly. Okay, so that's the pros and cons of Midodrine. Now I'm going to talk about Fludrocortisone. Fludrocortisone increases the central blood volume by telling the kidneys to hold on to more fluid and salt. And so it's as if there's a reservoir of water where you've now built the dam higher, and so the reservoir of water can be higher behind the dam. So that's what's happening with Fludrocortisone. It's telling the kidneys to hold on to more salt and water, therefore expanding your entire blood volume. And in doing so, there's more blood ready to enter the heart when the heart opens up to ask for more blood. So Fludrocortisone lasts for a long time. In fact, it lasts for more than 24 hours for any given dose. And it builds on itself such that you start taking it once daily, and it takes about 3 weeks to get up to its full effect. And once it's up to its full effect, you have this increased blood volume, and you feel the benefits. But the downside is it's a steroid-type medicine, and it causes some issues being a steroid medicine. One is it lowers your immune function just ever so slightly. So sometimes patients will get something like oral thrush or something minor like that, and that's rare. More concerning and common is that some patients will get moody on the medicine, and occasionally some patients will even get depressed on it. So that is sometimes limiting in its use. And if you have a strong history of severe depression, then I wouldn't recommend that medicine until you were out of all other options. So those are the two main medicines used for orthostatic intolerance. And then in using one of those two, or even sometimes both of those medicines, it sets you up for the ability to use some other medicines that are not easily tolerated, such as beta blockers. So sometimes those are the base medicines used to increase your blood volume and your blood pressure a little bit so that you can tolerate medicines like beta blockers. All right, so that's my background on Fludrocortisone and Midodrine.